watchers as well. You can write it in the chat box in the YouTube live stream. We are there, so we'll definitely transmit your question from YouTube live stream to Zalal, and he will be addressing some of them. So yeah, without further ado, let me invite Zalal for the stage. He will introduce himself and continue with the workshop. Thank you so much, Zalal.
All right. Hello, everyone. I hope you can all hear and see me. Can I get a confirmation on that? All right. Thank you, Bamnat. So let me just quickly share my screen. Okay. So can you all see my screen? Yes? Okay, great. All right. So welcome, everyone. My name is Alam Brahanu Bokala, and I'm the business and product lead at Africa to Silicon Valley. So today we'll be having a workshop. It'll be about creating an effective pitch deck. And so let's start with the pitch deck. In the end, I'll have some time for Q&A. So if you have any questions, just keep them with you and you'll get to ask me in the end, okay? So let's start. So first of all, what is a pitch deck? So a pitch deck is a presentation that introduces a business idea, product, or service to potential investors, partners, or customers. So essentially, a pitch deck is a concise presentation that helps investors and clients to understand more about your business, including your products, services, goals, and strategies. So you have everything about your business in a concise manner in your pitch deck. So a pitch deck usually has a certain format, and although some things can differ based on your growth stage or your round of funding, it could differ, of course, but these 10 slides are the ones that you find in all pitch decks. So it's very important for us to take a look at all of them. So the first will be your title slide, and then your problem statement. You have your solution slide. You have the market opportunity slide, your business model, marketing and sales strategy, competitive landscape, financial projection, your team, and finally you close with your call to action. All right, so now we're going to take a look at all of them turn by turn. So let's go to the very first slide, which will be your title slide. So in your title slide, you'll be putting your the name of your company logo, and a tagline or a one sentence description of what you do. So you should definitely take time to ensure that the name of your company and your company logo align with what you intend to do. So this is very important. It will be the very first thing that your audience will hear about your company. And then you should accompany this with a tagline that will be memorable in the minds of your audience. So if you create a very memorable tagline, your audience will be reciting that in their heads throughout your presentation. So that's also very important. You should take some time to develop your tagline. So after this, we move on to the second slide, which will be the problem statement. So the problem statement is where it all starts. So all companies, all businesses, they start by solving a problem. So in this slide, you clearly identify the problem that your business aims to solve. So you should explain the significance of your problem. You should really convince your audience that what you're trying to solve is actually a problem and that it needs a dire solution to it. So you should take your time in identifying and proposing a nice problem statement, and you should provide data and evidence to illustrate your problem impact. So this gives your audience a very clear picture of the problem and the intensity, the gravity of your problem. So after convincing the audience that there is in fact a problem, you move on to your solution slide. So in your solution, you will describe the product or service. So this is where you tell them how you address the identified problem. So in this slide, you should make sure that there's a direct correlation with your problem and your solution, because your solution should address exactly what you've described in your problem statement. So you should make sure that there's a direct correlation, and you should clearly describe what your product is or what your service is. And you should also highlight unique features and benefits of your solution. So you should tell them how your solution is going to solve your problem, how it will be working, what benefits it will bring, and the unique features of your solution. So here you've started with your solution, and moving on, you move on to the market opportunity. So in the market opportunity, you provide an overview of your target market. So your target market is who you are targeting. Is It's who your product is for. So you should define your target market and its size. So your target market could be, um, let's say, small to medium-sized businesses in Ethiopia. Take take small and medium-sized businesses. Perhaps you could say there are around 3,000 established small and medium-sized businesses that revolve around tech in Ethiopia. So that's your size and that's your target market. Um, so next, you should also outline the market trends and the growth potential. So the market trends is smartphones within these businesses have been increasing steadily at a 25% per annum rate. So that's the trend that you've seen in the past 5 years. But it doesn't only stop here, because in some cases the trends could have been good, but you might not really see a future in this trend, because it's not always that you see a continuing growth, right? Stops, halts, and goes down. So you should also make sure that you tell your audience that there is an increasing growth potential in the future, in the coming years. So you can say in the next 5 years, it's been projected that there will be usage of, let's say, 500 million smartphones in small to medium-sized businesses in Africa. That could be your growth potential. So now you've established the trend that we've been seeing in the past, and you've also established that there's a growth coming up in the future. Phone or MacBooks as a prestigious product. So that's why they are able to price it way up high, because people will value it much higher. They don't only have to put the markup pricing on that. They can charge based on the perception of their target market. So it might cost them $100 to make, but they can charge you $1,000. So this is a value-based pricing, and it usually works for brands which already have names for them, or when use cases are deemed luxurious. So there are also different pricing strategies like these. So it will definitely depend on your business, your product, your service. So you should make research on this. So now that we've covered our business model, we'll move on to our marketing and sales strategy. So now you have a product or a service, but it has to get to your target market. And that's what marketing and sales strategy is for. It outlines your plans to attract and retain customers. So here you can discuss different marketing channels, different tactics, and different sales processes. So perhaps you might be thinking of having only online presence, or you can also think about having offline presence as well. You can form partnerships with different individuals or organizations. You can have a door-to-door method. You can have a cold calling method. There are different tactics for marketing. So this also depends on your product. And if you want to be innovative, you can use different methods um, to market your product. So here you should include any partnership or distribution strategies if you have one. For example, these days partnering with influencers is a very ideal method of marketing your product. So if you have different methods like that, if you've thought of different personalities, you should mention them here. It shows that you've really thought it through. So this is your marketing and sales strategy. It all depends on your product. Try to be innovative. Try to stand out in the way you market. So that is important to stand out of the crowd. All right. So moving on, we'll go to our competitive landscape. So in many cases, almost in all cases, it won't be only you that have thought of a solution for that specific problem. You'll likely have many competitors, or there will already be different alternatives in the market. So in this slide, you should identify the key competitors in the market. Um, so um, After you've identified them, you should highlight your competitive advantage. So your competitive advantage um, is what makes you stand out. It's what makes you different from your other alternatives. So you should highlight what makes you unique and what special values that you provide. So this is very important. It helps you to stand out of the crowd. You can use a comparison chart to show how you stand out. You can list different features that you have that they do not have that would definitely be beneficial in solving the problem. So you can use different methods to show how you clearly stand out from the crowd. And this is a very important slide because it tells your investors or your clients why they should choose you instead of the others. You should really convince them with your competitive advantage. All right, now once you've done this slide, we'll move on to the financial projection. So in the financial projection, you'll provide a forecast of your revenue and your cost for the next 3 to 5 years. So this is also very important because it shows the investors or clients that you're preaching that you've thought it through, that you clearly know what your costs are, what revenue you expect to gain, and you should also include key financial metrics. It could be profit margins, your burn rate, your customer acquisition cost, and there are many different financial metrics that could be important based on the solution that you're bringing. So take some time to identify these key metrics for your product and do a forecast for them if possible. But definitely revenue and cost forecasts are very important. So in this slide, the goal of this slide is to show that there's a clear path to profitability. So your investors want to know that you will be profitable after X amount of years. So here you should show them that your cost, your revenue will surpass your cost at some point in time, which will be your break-even point. And starting from then, it will purely be revenue. So yeah, this is your financial projection, and you should take some time to identify your financial metrics for this. So moving on, there will be your team slide. So now you've identified your problem, you've proposed a solution, you have done different researches regarding your market, regarding your competitors. You've introduced your business model, you have your forecasts. Um, so all is good on paper, but when it comes to actually doing it, it will be the team who will be undertaking these tasks. So it's very important that you convince your audience that your team is capable of handling these things. They should have confidence in the team members. So here you should introduce your founding and key members, and you should also highlight their relevant experience and expertise. You should highlight why they would be the right set of team for this specific solution. You should also include any notable advisors or board members that you might have, so that it gives your team more credibility that you're backed by people who already have experience, and that you also have notable advisors who will be advising you in different steps of your journey. So here you convince your audience that you'll be the right team to undertake this task. So after doing this, you'll have your very last slide, which will be your call to action. So your call to action is what expecting from your audience. So when you give an audience a presentation, it almost always has some purpose, right? So your call to action is where you clearly state your purpose. So you have to ask for either investment amount or partnership, or you could ask for mentorship. It could also be different things based on your needs. Um, but these three are common things that you should be asking your audience. So now you know your revenue, you know your cost, you have your projections. So you could ask for an investment amount. So if you can invest this amount in me, I can make sure that the project is successful. Or perhaps you can ask for partnerships where you can say, we'll be working on this. I will need help on this segment. So let's work together. So it could be different things. And lastly, in your call to action, provide your contact information. You should provide your email and your phone number, your website, link to your app, everything that you have. And giving your information, your personal information, especially like a phone number, gives them trust. It gives you credibility. It makes them feel that they can call you anytime. So yeah, definitely provide these information. So this will be the very last slide, and now you're done with your pitch decks. Now it will be time for question and answers. Pamnet, you guys heard me right? Intellectual property just from a pitch deck. So a pitch deck is very common. It's presented everywhere, unless you give out your blueprints and the tiny details of your product, then it usually isn't a problem. And for the second question regarding the mentorship, I would pass that question to Pamnet. Uh, Pamnet, can you handle this question? The second one.
Um, can we, good morning, I'm from Nigeria. Can we have this slide available for us, the guideline slide?
Yeah, the slide will definitely be available. Yes, it will be shared. I'm sorry, Keith. Pamnet is not responding currently, but yeah, we'll definitely give you the answer.
Oh,
Okay.
okay. All right.
Yeah, there will
Uh,
definitely be support. But regarding the details, so he'll answer that.
oh, okay. Could you please send an email as well? Should I drop you an email, perhaps?
Yeah, yeah, sure, definitely. Leave it on the chat box.
Or
Okay. So yeah, I see that Takutzwa also has raised his hand or her hand. Uh, you can go ahead, Takutzwa.
Okay, so thank you very much for the opportunity. I hope you can clearly hear me. So I want to ask on the website thing, if your team doesn't, is it any disadvantage if your team doesn't have a website here, or that you can put? Is it a must? We are just giving it, or we can put other social media platforms.
Actually, you didn't catch that. I didn't catch that. Sorry.
Okay, so I was asking, at the end you talked about putting website link. Is it a must for teams to have websites, or you can use other like profile, other like I think you can run transfer.
Oh, I see. I see. Okay, so you're talking about the call to action slide, right?
Yes.
Okay, yeah. So there, no, it's not a must that you have a website. I'm just saying you should put any relevant information that can give them an insight into your product so that they can do their own research in their own time. So perhaps if you have a website, then good. If you have a mobile app, if you have a tangible product, an Amazon page, anything that it could be anything. If it can give them more information about your solution, then that's what we're looking for. Okay, so Abdulaziz, you
Thank you
can go ahead.
very much.
Okay, so yeah, okay. My question is that in the maybe semifinals or in the finals, are we meant to bring our app together? If we are developing an app, are we meant to bring the app together or the software or anything we are trying to do?
I see. All right. As for the requirements for the hackathon, I will also pass that pass that question to Bemnet. Um, Either Bemnet or is Bethlehem around? Bethlehem, is it possible that you can answer this question? Okay. Bethlehem and Bemnet aren't around, but I've noted it down. I'll also send you the answer to that. Uh, can you please share your email, perhaps?
Okay.
All right, thank you. So, questions, Ayebila? Ayebila?
All right. Yes, thank you. I think that was a great presentation. And so far, I think this is probably one of the most organized hackathons that I'm participating in. And you guys are doing a good job. So my question is, I think I read on the website that master students are not allowed to participate in this hackathon. And then we also understand that it's now being allowed. So I just want clarity from you if that's the case, that master students can participate. My second question is, if you have an idea that is big and has so many components to it, what would be your advice? Focus on something small for this hack, and probably narrow down, build something small for the sake of this hackathon. Thank you.
All right.
All right.
So,
So,
no,
what- yeah, sorry. So, I'm just going to address this question, but for the others, if like that's Q&A part, it should be related with the workshop. So, yes, master students are not allowed to this hackathon to create a fair ground. And I don't remember what was the second question.
I'm not sure I heard the answer properly. If you can just say that again.
Well, what was the second question? I was asking you what the second question was.
Oh, okay. Yes. My second question is about if you have an idea that's a very big idea.
so Bemnet will take over for this. Bemnet, are you there? All right. While we wait for Bemnet, let's question is, on the business model, do we need to include all the columns from business model template? So let's go back to the business model template. All right. So here, yeah. So these are only two things that you need to include in your business model. So the first is how you plan to make money. That is your revenue stream, and then your pricing strategy. So the pricing strategy, perhaps you might not be required to do this at this point in time, but it's also a very important variable that you need to consider. So I would say focus on the revenue streams And if you've thought of your pricing strategy, include it to be judged by the judges. So it will give you more um, it will give you more inspection by the judges that you've really told us. But since you're not going out with your idea right now, your pricing strategy might not be uh, might not be 100% required. But if you have some ideas, definitely put it on. The revenue stream will help you. So I also had another question. For the product we are meant to produce, what if the product is hardware? So yeah, that's definitely okay. It has to have some AI integrated into it. So that's up to you to figure out. But if you have that aspect ticked, then it should be okay. And you also handle your business models, your marketing strategy accordingly. It has to be specific for a hardware, but it should be okay. All right, Abdulaziz, do you still have a question or is it from before?
Yeah, I have
Okay.
another question. Okay, in the problem statement slide,
Okay.
you said we can illustrate. Can we illustrate the problem using some videos? Maybe we have a video to show
Mm-hmm.
to on how the problem the people are facing in the community or any place. Can we show? Can we use illustrate? Apart from the write-ups, can we also use video to add to the problem statement?
Sure. If you have a video, perhaps with the actual problem or with some infographics, that would be okay. But in some cases, you share your pitch deck. When you send it over, it has to be, if it's especially in a PDF form, it can't be viewed. So perhaps make sure that there's a hyperlink for it that leads to a YouTube link. But yeah, if you have a good and convincing video for your problem statement, then that So Mamoria is saying, may you please explain on the marketing opportunity slide? We have missed it. Okay, let's go over the marketing opportunity slide once again. All right, so your marketing opportunity. So here is the slide where you provide an overview of your target market. So your target market are the ones that your product or your solution is meant for. It's those people who are experiencing the problem statement. So here, what you should be doing your target market and its size. So perhaps your target you specifically for. Right, do we have any questions our uh, from our YouTube audience? Let's check.
There is one question in the chat box, Jalal. If that's why we are having this workshop with you guys. So just to be clear, before the quarterfinals, all you have to do is just submit your project idea through the project idea submission form. And if you want a link for that, I will share it right now in the chat box.
Or should we wrap it up? What do you think?
All right. Actually, before we wrap it up, I have some announcement here. Yeah. So first of all, thank you, Zalana, for presenting this pitch deck for us, so that we can learn more about on how to prepare a pitch deck. So yeah, guys, as you know, this is a workshop. So in order to get the best out of it, it would be great if you guys get your hands dirty and start working on some pitch deck. So right after this, we're going to have kind of a small group session with some of our
So we have, roughly speaking, about 15 mentors, and we are going to create breakout groups for you guys, like potentially 3 people at each group. And then this group is going to go through stages of preparing a pitch deck. So in the end of this, let's say 40 minutes, we are going to have one pitch deck that 3 of the members of the workshop and one mentor together prepare. And in the last 20 minutes, we are going to see some of these pitches, the ones that want to present and get feedback. And then altogether, we are going to provide feedback for those presentations. And in the end, we hope that this whole process is going to help us to utilize generative AI and build effective pitch decks that are going to represent our idea, which problem we are attacking, our solution, the market potential, competitor analysis, financial plans, marketing strategy, and our call to action. So for that, let's wait for Belen to get the control of the breakout rooms. Belen, are we ready? Okay. And in the meantime, if there are some questions, feel free to bring them to the table. Okay, if there are no questions, Zelala, while we are doing the setup, how about going over one of our pitch decks? Like, at CoreDev, we have 5 projects which are going to launch soon. Some of them, they are about to finish beta testing, and we see very good engagement. Like, if there are any good ones that you want to show us, actually go over one CoreDev pitch deck while we are waiting for the setup.
Yeah, definitely, Emre. All right. So give me some time to open it up, and then I'll share my screen.
Thank you.
And in the meantime, I can give information to our attendees about the core dev projects at A2SV. So A2SV is not just a non-profit tech academy. We are also building digital projects for Africa. And in that regard, like right now, 1.5 years ago, we have initiated our core dev unit. And in the first generation of core dev projects, we have 5 of them. So these are trying to solve different challenges in our communities. ADOT is aiming to help pregnant women in Africa to learn more about how to take care of their incoming babies better. And this is utilizing generative AI. This is connecting doctors with their yes, like this one. We have 4 more. And now, Belen actually let me know that we are ready to create the breakout rooms. So we are going ahead and doing that. And Zelalam, until the setup finishes, until we let our people go, would you like to quickly go over one successful pitch deck?
Yeah, sure. Over adults pitch deck. So as Emre mentioned, this is our one of our core dev projects. So I hope you can all see my screen. Can you see my screen? Yeah, all good. Okay.
Yes, yes.
All right. So for adults, so first of all, we have without telling you about adults, let me go over the pitch deck and see how much you understand and put yourself in the position of a potential investor or a client and see what you understand from this pitch deck. So the very first slide is your title slide, and you have the company name, our logo, and our tagline, right? So empowering mothers on their pregnancy journey. That's our tagline. So we move on. So here we've added a mission slide, and this is because we are mainly a mission focused and impact focused project. So this is why we added this slide. So it states ending preventable maternal deaths in Africa by connecting mothers with medical professionals and essential resources. So here we've given our mission. It hopefully relates with Africans. It also has mothers and our doctors, so we really relate to it. And then we start with our problems. So what problem are we trying to solve? So we've identified 3 problems. The first is lack of culturally tailored, locally understood motherhood information. Our second problem is difficulty in the monitoring pregnancy journey. In monitoring pregnancy journey. Our third problem is insufficient support for mothers. As you all can see, these are clear, very simple. They are divided into 3 distinct problems. So moving on, now that we've stated our problem, we also help our audience see the market potential for this. So as you can see, the very first is the trend. So what we have until now is we have 46 million yearly births in Africa. We have 287 million mobile users in Africa, and we have $51 billion market cap in the global femtech industry. So this is the trend. It's what we've seen until now. So what does the growth potential look like? So in the year 2030, that's a year that we've chosen. As I've said before, you can choose based on your project. It can be in the next 10 years, 5 years. It depends. So in the next, 6 years from now, yearly births in Africa will be 50.05 million. Mobile users will be 393 million. And the market cap and the global femtech industry will be $103 billion. So as you all can see, there is a clear growth potential in these projections. So that lets our audience and our investors see that there is, in fact, a lot of room for growth. So this is what they want to see. And moving on, we'll have our solution. So we've clearly stated the problems, and now we're providing a solution for that. And our solution directly correlates with the problem. And let's see what the solution says. So, a platform combining medical and tech expertise to offer pregnancy monitoring, local information, and community for African mothers. So, this solution statement covers all the problem statements that we've listed before. We also have a demo or yeah, a preview of our solution. So it's a mobile app, and this is the homepage of the adult app. So moving on, we've also added a value proposition slide. So a value proposition is different from solution. So what is the difference between these two? For example, let me give you an idea. So let's say there's okay. So let's say you all have smartphones, right? So in your smartphones, there's a company that is addressing the problem of very short battery lives. So for that, they're providing a solution by having a better battery that can go for a long period of time without needing to charge. So that is their solution. But what is the value for this? So the value is perhaps they can have you relate your adventure to your weekly or monthly adventures where you go out hiking, and you do not need to charge it. You do not need to return back home. You might escape danger or an emergency because of your longer battery life. So it provides value like this. Having a longer battery life has different values like this. So the solution is the better battery itself, but the value could be so many different things. So we've added our value proposition here. Um, So next, we also have our go-to-market strategy. So our marketing strategy here is first to partner with hospitals and medical institutions. Second, to onboard doctors on Ido's platform, and third is to onboard. It's for doctors to onboard their patients. Excuse me. All right. Thanks. All right. So we have three clear marketing strategies for this. So we have tried to be different to stand out. We aren't saying some generic things like we'll be having an online presence on Instagram and Facebook, because that's, as I've told you, it's generic. It's what everyone does. But partnering with hospitals, onboarding doctors onto our platform, that's different, and that's how we try to market our product. All right, so moving on, we have our revenue streams, or these are our business models. So we've proposed four different types. So the first is advertisement. So for advertisement, we'll connect vendors with customers by promoting products like maternity wear, baby toys, and other health supplements. So when we do this, we provide an advertisement on the homepage, on different pages on our marketplace. So ad revenue can be a good source for different apps, especially if it's online based. Our second stream is marketplace. So this is where we feature different products that are related to maternity, health, and hygiene. So different vendors can come to our platform and they'll have a marketplace, and our target market are mothers. So they'll have a direct connection to the target market that they are looking for, which provides them value. Um, so the third option that we put is a hospital service fee. So we enable doctor-patient communication and charge hospitals for the service. So a hospital can market itself by saying that that they'll enable doctor-patient communication in the comfort of their home. So that's additional value that the hospital adds for their patients. So the patients are can pay more for this service. So that's how we uh, target the hospital through this revenue stream. And finally, premium subscription. There's also a common method for most online platforms. So we provide ad-free browsing, medical consultation, and personalized guidance by medical professionals whenever you subscribe for a premium model or a premium subscription. So these are our revenue streams. They're very clear, and there are four methods that we put out. So our competitor analysis is the next slide. So here we've identified our competitors in Africa and also globally. So we've listed some features. So in these features, we've tried to show how Ado stands out. So let's take Zero Mother's Day for example. So it's a well-known app in Africa, but comparing it to adult, it doesn't have the pregnancy monitoring tools, it doesn't have the local language availability, and it doesn't provide communication with doctors. So this clearly makes us stand out. And there's also the My Pregnancy Journey app, which doesn't provide communication with doctors, which we're using to our advantage. So you can create similar tables like this in order to show how you have a competitive advantage over your alternates. So moving on, we have our team slide. So in our team, we have quite a bit. We have 10 members here, which includes medical doctors. So you can see how adding medical doctors really works to our advantage because it gives us credibility since we're working on a medical app intended for mothers, and we have two medical doctors in our team. We also have our project lead, our backend developer, our product manager, mobile developer, web. So it shows that we have a holistic team which comprises of different departments. And moving on, we have our advisors slide. So adding our advisors, our notable advisors, will help in gaining the trust of our potential investors and our clients. So it shows them that we have a technical advisor, our business advisor, product advisor. But not only that, it shows the experience that our advisors have. Because if we state that they are our advisors, they must be significant in one way or another, right? So they must have a long-standing career, or they should have very good achievements in their sector. So here we also show, for example, let's take Summit. He's our technical advisor. He is a senior machine learning scientist at Overjet. So you can see how this adds to our platform. We can take Emre Varol. He's our business advisor, and he's the founder and CEO at A2SV. He's an ex-Google Palantir liftoff ML engineer. So we can clearly see his accomplishments, and it will be wise for us to take advice from such an experienced person. And finally, Salman Kadrioglu, who's our product advisor. He is a chief product officer at Parity, ex-Meta technical program manager. So you can see when we have advisors like this, it's most likely that our team is going to succeed. And this is what our potential financiers will want to see. And finally, we're finishing. This will be our very last slide. It's our call to action slide. So here we do not have a clear investment ask because that's not the intention of this speech deck. As I've stated in my previous workshop, there are different ways. I mean, there are different reasons to preparing a pitch deck. It could be for a partnership, mentorship, investment, and there could be other reasons as well. So here we've finished with our tagline. We have our company name and logo, and we also have our contact us. So here we have our email, our website, link to our link tree, QR code to our link tree, our address, phone number, and we tell them that we're backed by Google and under A2SV. So this is it for adults, and this is what pitch deck should look like. Thank you all for listening. If you have any questions, you can raise your hand.
Thank you very much, Zelala, for the presentation. And team, now it is time to jump into the breakout rooms. I think everybody at the moment should have received the invitation. So please click join and jump into breakout rooms. And I will be also doing the same thing. And with one of the groups, we are going to continue the practice time. And together, we are going to prepare pitch tent with ChatGPT. All right. Thank you, team. Let's do that.
Okay, so hello guys. The breakout rooms are in session. So please join your assigned breakout rooms immediately. Okay, so those of you that are remaining, I see Akol and Brandon, and also Ahonakopon. Please join your breakout rooms.
Talcum, are you there? or maybe Paulus.
Yes, hello Zalalam.
Yeah. What should I be doing now? Am I also supposed to join the breakout room or?
Yeah, so hello Zalalam. Yeah, we will be assigning you a breakout room right now, and you'll be able to join.
Okay.
Hello Zalalam. So all the current breakout sessions are have a mentor right now. So whenever there are new people joining, and there is a mentor, we'll be assigning you.
Like as you know, but there are many great machine learning models, large LLMs, large language models that are coming out and that are super helpful for everybody. There is a lot that we can do with generative AI. It can help with so many things, including pitch deck preparation. And what AfroChat does, AfroChat allows you to work with whichever model you want to work with. So in one interface, you have access to all available free models. And the premium version is also being delivered. Hopefully soon that will be available. But at the moment, if you want to try OpenAI's model, try Facebook's model, Google's model, Cloudy from Anthropic, all these models are available here. That's why we wanted to do this demonstration with AfroChat. And this is also one of A2SV projects, by the way. It's for free. All the applicants can use to take advantage of generative AI. Yes. So now, before we start team, like we also prepared a prompt that we can use to share the content of the pitch deck. Actually, there's even a better one. There's a prompt that we have prepared, which actually gives a bit of an information for the structure we have for pitch deck. So let's go over it all together. So this is a message for our model here, so that it's going to help us in the best way in this workshop task. Hello, GPT. We are participating in a workshop to help African tech talent create compelling pitch decks for innovative projects. As mentors, our goal is to guide students through each section of their pitch deck, ensuring clarity, impact, and professionalism. Let's start by understanding the structure and purpose of a pitch deck. Please provide a brief overview of what each section of a pitch deck should include, focusing on the following: cover slide, problem, solution, market opportunity, business model, marketing and sales strategy, competitive analysis, team, financials, milestones, and projection. This will help us set the foundation for our breakout sessions. Thank you. And the breakdown for matters to use. So for the cover slide, we will use the ChatGPT to generate a company title and tagline. Then we are going to define the problem with the help of ChatGPT. Solution, market, business model, marketing and sales strategy, competitive analysis, team financials, milestones, and call to action. So this is the task. Like right now, we don't have it yet, this part of it, because the prompt is not for GPT. So I'm going to go ahead and delete the mentor instructions. Yes. Now, I want you to ask questions to understand our solution idea, digital product pitch. Ask one question at a time. Because one of the most powerful things that you can do with generative AI is helping it to understand the problem better. And in this case, the problem is our idea, right? It needs to understand our idea better so that it can help us in the best way. So allowing it to ask questions is always good. But when you don't limit, it asks so many questions at once. So that's why I said, okay, let's go with one session at a time. So what specific problem or challenge we are trying to address? Now we are open for ideas. Armel, do you have any idea that you want to bring for us to prepare pitch deck content?
Yeah, maybe. This is quite close to what was presented in the demonstration. Let's say like a mobile app, for instance, in medical sector to help people in not deserved area, like people who do not have access to healthcare, to use that app, for instance, to schedule like a meeting with a doctor or something like that instead of going directly to the hospital, because there are some villages, for instance, who are very far from the closest hospital, so that instead of going there, they can schedule a meeting with a doctor from the house and do a consultation or something like that before going to the hospital, because maybe they are in emergency or something like that. This is not really elaborate, but yeah, that's the idea I have.
Got you. So, like, I'm trying to get problem from that, and this is what I come up with. In some areas of Africa, access to hospitals and medical facilities is limited. It is difficult to get consultation for people who live in those areas.
Yeah,
Does that capture the problem we are trying to attack, right?
yeah,
Like the
yeah,
general
exactly.
problem. Perfect. Okay, it's actually yes. Okay. So next, now I think we are focusing on solution. So how are we going to provide a digital solution, or what kind of solution you think? Maybe not digital. It's your idea, right? And how are we going to solve this problem? What can we do about this? How are we going to improve access to medical consultation for people who are living in those areas?
So, from my point of view, there are two ways. Actually, the first one would be to schedule like a virtual meeting with a doctor, but the main concern here would be the fact that people in those areas won't have access to internet. And then the second thing comes up, uh, installing like uh, internet access for all those people so that they can schedule consultation using a public phone with a doctor.
However, those people usually don't have internet
Yes,
access. Therefore, could you please tell that part again? Like you mentioned about public phones, right? So how are we going
like
to get them connected
yeah,
to the internet? Like
like having an
and the
access
last
point,
one.
a public access point, so that people can come at that place and use the public phone to schedule appointment with doctor.
public those access points to have internet access and schedule schedule medical appointments. Mhm. So, like, that's capture the whole idea. Like you mentioned, maybe two stages. Like I started numbering, or is there another solution that you want to mention now?
Yeah, the second solution will be to have within the app have like a whole section dedicated to prediction, because when the user recreates his account and so forth, there will be a step in which will fill the user detail, like um, the current information about his health, uh, what he can eat and what he can't, like detailed medical information, so that we can predict exactly, not perfectly, but implement a machine learning model to predict which disease he can catch and what are the symptoms, so that if something happens, they can go through those and see if the symptom he currently have is close to one of the predicted disease.
Offline manners. Like basically, we try to do our best utilizing machine learning here, so that we want to help them in the offline situation, right? Like, let's say they are home, there is no internet, and we want the app still to provide some medical help if it can.
Yes,
Is this okay? And this can be like making diagnosis or providing medical suggestions, right?
yeah,
And in the
perfect.
future, maybe it can even get further and even give maybe nutrition suggestions, etc. Right? But the important part is this has to work in an offline manner, right?
Yeah, sure.
Okay. Then let's continue. Yes, thank you for sharing those details. It's clear that your solution aims to address the challenge of limited access to medical consultations in areas with connectivity issues through remote appointment scheduling and offline medical assistance within the app. To delve into deeper your solution, could you elaborate on how you plan to ensure the reliability and accuracy of the diagnoses and medical suggestions provided within the app, especially in offline scenarios where direct connectivity to healthcare professionals may be limited? Like basically, this is a question about generative AI has some limitations, right? Sometimes it may not give us accurate results. Like sometimes it works well, but sometimes it makes mistakes, right? Like a human.
Yeah, sure.
So basically, the question is about how are we going to ensure accuracy or reliability of the data that we are providing, the medical data, because it's sensitive. People can make some health decisions based on what we provide, right? So how are we going
Mhm.
to ensure that it's going to be accurate? That's the question.
So my approach to that would be to work with doctors, I mean specialists, something like that, so that they can validate the accuracy of the, yeah, I would say accuracy of our machine learning algorithm, so that when the user is creating his account, we can advise him or notice that the accuracy of our current implementation is up to this percentage. If you have access to internet, we suggest you to book an appointment, but if not, then you can use the offline solution. But maybe we will fix our model accuracy for some to something like uh, 95% or 97%, so that it can be as accurate as possible, but validated by professional expert in that the field.
Okay. Right, and like 97%. Very nice. That's a thoughtful approach to ensure the accuracy and reliability of the diagnosis. and medical suggestions within your app. Collaborating with doctors to develop and validate the models can indeed help maintain a high standard of accuracy with a target threshold of 97%. Further understand your strategy. Could you explain how you plan to involve and engage healthcare professionals of diagnostic models? Like, how is this collaboration? Like, are you going to make partnerships? Do you already have connections with some doctors?
So, the way I think about that is we have mainly two categories of professional: those who work in public sectors like public hospital, and those who work privately. So, for those working privately, we'll mainly provide them with more customer. I would say I'm saying customer in this uh, uh, case, but it's like patients, they will have access to more patients that they can get more revenue, something like that. But for public sectors, those working in public sectors will help the government covering more area in their respective
Mhm.
country. So yeah, I think that's the two idea I have right now.
I see. Mhm. So you are actually telling us about how this is going to provide value for the medical people. They would be incentivized to work with us because of, indeed, at the end of the day, this can bring more patients to them, like the ones that are using our system, right? They can get connected with those doctors that are more living in the industrial area. In the future, we can open such connections. And plus, like those people also want to help for healthcare reasons, right? Like they want to help public to get better service. So they would be open to collaborate. And here in the question,
Yes.
it's also asking like how like the details of the collaboration. Like I would say, we collaborate with the private and public hospitals. We will learn from their data records, right? Like they are already collecting some data about their patients. This will help us to train the models. Then we will make the models used get used by the doctors to measure their accuracy in real world environment. When we clearly see that they reach over 97% accuracy, with statistical confidence, and doctors' approval, we'll first deploy in areas where internet connection is available. This way, even if there are some issues, we can check accuracy with doctors as well as other ML models through sending the patient data to servers and assign doctors. Once the metrics look good enough, we can deploy our solution in offline environments. So I have made some addition, like basically to make the plan step by step. We can start with first doctors, right? Instead of giving recommendations to the patients, we can first give the recommendations to doctors and collect data from them. Is this accurate? Is this not accurate? And based on that, we can actually measure during development how great our models are. When the doctors are like, hey, this is good enough, you can actually start using this on the patients. We can first start with users who are already connected to internet so that we can do tests like whenever we make a recommendation from the offline model. This can be validated with the online model, which is larger, more accurate. And the same query can also be sent to a doctor. And the medical doctor can also check whether the recommendation is good for the given case or not. And once we have also in the online environment great results, we hit our accuracy bar. Then, and we get the, let's say, on, agreement and approval of the medical institutions. Then we can start deploying this in the offline environment. So this way, like step by step, we can increase our area of influence and finally make it reach the offline environment. And we can confidently say that our models are at least going to have decent amount of accuracy. It's great to hear about your comprehensive approach to involving healthcare professionals in the development and validation process of your diagnostic. Leveraging data from private and public hospitals, training models, and then testing them in real-world scenarios with doctors' oversight is a robust strategy to ensure accuracy before deployment. To gain a clearer picture of your implementation plan, could you elaborate on how you intend to address any potential challenges or limitations that may arise during the deployment and testing phases, especially in areas with limited internet connectivity? Tim, I won't go into details here for the sake of saving time. So again, these models are not perfect, right? And sometimes you may want to change the direction by, let's say, making an intervention. And we can say, let's not dive into details of solution for the sake of time. Move on. Based on the pitch deck template. The next step. All right, so next is market opportunity. And do we know which market that we want to target at the beginning?
All right.
Yes, Arman.
So yeah, let understand. I am marketing impulse to provide the site to the broad scope of. Okay, so I'll take my country for instance. Access to healthcare is mainly available for people around uh, Cotonou. Cotonou is a city. Cotonou, Abomey, Calavi, Dodoma, and so forth. But
Is it written
for
like
people
this? Cotton?
with C instead of K.
With C. Okay.
All right.
Yes.
But from
And
people in north of Benin, something like that, it's very difficult to have access to healthcare service.
it is difficult to get the service, get healthcare access. Okay. And how many people do you think are living in those areas?
Actually, they have some hospitals. It's not like there's absolutely no hospital, but it's very difficult to get access to those. So most of the time, if something happens, they will do their best to get access to the closest hospital. But if something happened, like if this is an emergency and something happened, they do with that actually because they don't have any choice.
Got you. And like, how many people do you think are there like living in the north of Benin? How many people do you think at the moment are in the offline areas that are going to get benefit from this product?
Um, Actually, it will be like at minimum half of the population of Benin, because health accessory is available for people around the south of Benin. So for the north, I will say around the half the population in Benin.
Gotcha. That's a great start point to focus on Benin, especially target areas with limited healthcare access like the north. By identifying half of the population as your target market, you can tailor your solution to meet their specific needs and challenges. Conducting market research in those regions will help you better understand demand and preferences of the target population, allowing you to refine solution accordingly. It's essential to engage with local communities, healthcare providers, and stakeholders to ensure the success and impact of your initiative. Okay, now let's continue. All right. Let's continue with the next step. Don't forget, your task is to get information from us. Us can clearly pitch deck. Continue getting more information about different slides. Okay, so now like it's giving us instructions how we can actually prepare our presentation slides. So let's say prepare the slide content with the information you got from us. So right now, like it has prepared some content to us, and like this is plenty of textual information for an attractive presentation. At the same time, if we put this together in a nice format and like do some, let's say, shortenings in the bullet points, this can actually do the job. So let's see. In the problem statement, what we have, many regions in Benin, especially the north, face significant challenges in accessing healthcare services. Limited facilities and resources in the north result in difficulties for residents to receive timely medical care. The disparity in healthcare access negatively impacts the well-being and quality of life of the population in these underserved areas. So, like for the problem description, I would say this is doing a decent job based on the information that we have provided. And again, let's not forget, good can always be better. So the second slide is about the solution. And the title is Innovative Healthcare Access Solution. Our solution aims to bridge the healthcare access gap in the north of Benin by providing a comprehensive platform for appointment scheduling and offline medical assistance. Features include a user-friendly interface for booking appointments, accessing medical resources offline, and connecting with healthcare providers remotely. By leveraging technology, we empower individuals in underserved areas to receive the care they need, improving health outcomes and well-being. So one thing that I'm going to add to this part is obviously like the second aspect of the solution you mentioned, which was about providing access points, public access points. This is a very important part of the solution. And as you see, currently, it's not included like I am very happy that we are actually getting to such cases because for us to understand the current state of generative AI, it doesn't always do the right thing with one prompt. So we can have a conversation, we can provide feedback, and based on our feedback, it's also going to improve its performance. So let's also take a look at the market opportunity before we provide whole feedback. But now for the solution, or like let's go one by one. Like for the prep, we can say that Benin is where we want to start from, but we know that this is also affecting a lot of people in other areas of Africa. This is not only specific to Benin. We have many countries in which, in some areas, people have difficulty having healthcare access in Africa, unfortunately. So the first feedback point is the problem. Okay, we want to start from Benin. At the same time, the problem applies on other parts in Africa. And let's continue. And the second is one of the important aspects or one important part of our solution is providing public. We were calling access points, right? So that people can come, people who don't have access to internet can come and get appointments and online healthcare. Experience in leading the software engineers, some of the organizing. Yeah, but we're not doing so well, right? And like on the third one as well for the market, this is focused on the underserved regions of Benin. For the start point, I think this makes perfect sense. Okay, then we can say please apply this feedback. So our conclusion should be please apply this feedback to improve. It actually depends on just trying to make for years like gains so for universities. Yes, now let's take a look at the problem statement. Many regions across Africa, including Benin, face significant challenges in accessing healthcare services. Limited facilities and resources in underserved areas results in difficulties for residents to receive timely medical care. This disparity in healthcare access negatively impacts the well-being and quality of the quality of life of the populations in these regions. So in the second solution part, we also see public access points addition. By providing physical locations for healthcare services, we ensure that even those without internet connectivity can benefit from our innovative solution. So as you see, like with feedback, we can also improve the content. So we have a limited time, therefore I'm going to ask you to continue with the next slides. Can you fill out the next slides as well? We are running out of time. Please give us the continuation of the presentation based on the format we passed earlier. Don't forget, you should write the content, not a guideline, to prepare the content of the slides. Thanks. But basically, like the scientists and machine learning experts, they say it makes no difference to be kind, but it's nice to be kind. Yes, so let's see what we have. Implementation plan. Establish partnerships with local healthcare providers. Develop a mobile application for easy access to healthcare services. Train local community um, health workers to provide basic healthcare services. Set up telemedicine services for remote consultations. This actually makes very good sense. And then we look at the market opportunity. Over 60% of the African population lacks access to basic healthcare services. This is huge. The healthcare market in Africa is projected to reach to $100 billion by 2030. That's big number, guys. And our solution targets underserved regions with high demand for healthcare services. So when we take a look at the revenue model, premium model for basic services, subscription-based model for premium services, revenue sharing with local healthcare providers, and potential partnerships with insurance companies. Like I would say, in Africa, in many places, people are not very used to paying for software. So I'm not sure if the first two models are going to be successful. But revenue sharing with local healthcare providers makes sense. And maybe in the future, potential partnerships with insurance companies, because preventive healthcare would be in their favor. They don't want people to get sick very often. And for that reason, those two make more sense for the given circumstances. Let's take a look at impact and sustainability. Improve healthcare access for millions of people in Africa. This is amazing. Creating job opportunities for local community health workers. This is also very good contribution. And sustainable business model with potential for scalability. Well, like this is a claim. It really depends. Once we look into the business model, if it is strong, then we can potentially say, yes, this is sustainable and scalable. But this is too early to say that. And long-term goal, reduce healthcare disparities and improve healthcare outcomes across Africa. This is a very good mission. So next slide, like the milestones. Pilot the solution in a selected region, gather feedback from users and healthcare providers, iterate on the solution based on feedback, and scale the solution to other underserved regions in Africa. So these are very high-level steps, Steve, obviously. And it didn't bring us, I would say, our call to action. So we can ask, as I said, it makes mistakes from time to time. So let's ask our call to action to another model. Let's go to Mistral, or let's go to Cloud. Let's say. Can you also give us the content of call to action slide? Apparently ben switched model. We had an issue team. Let's go our home to see. We are going to see our recent chats. Yes. Yeah. Okay, for the sake of completeness, team, let's ask, can you give us the content of the call to action slide? Finishing. That was good. So let's get back to the main room. All right, team, can you guys hear me in the meeting room?
Hello?
Yeah,
Perfect.
we can hear you.
Excellent. In that case, team, let's get started with demonstrations. So our mentors, who wants to kick us off? Who wants to tell us about their journey and show us what they have come up with the help of generative AI models for the pitch deck content? Any volunteers, team? Yeah, head of academy, Biruk Sevda.
Yeah, sure. Hi guys, my name is Brooke. So basically for us, let me try to share my screen. Give me a second. For us, what we did first was go to ChatGPT, and we explained, first we discussed on what problem to attack in our pitch deck. And one of our members came up with the idea that most students don't know how to make the decision when joining a subject or a field of study, because trends are forever changing, right? You don't know in 5 years which department is going to be the most beneficial in terms of success, employment rate. So he wants to do data analysis and provide our customers or clients with predictions and provisions on which jobs are going to be trending in what year, right? That was the problem statement that we started from. And then we explained it to ChatGPT. We told it what we're trying to achieve. When we gave it the content structure for our pitch deck and the content generation, obviously ChatGPT is good at that. And we kept refining it, asking for more. At some point, it was generating names for our platform, and we were trying to choose from 15 names. I can't find it now. Yeah, this one. And we went with feature focus by the end after discussing among the four of us. And then after we finished the discussion, the content generation, we also were asking it to do market research, computer analysis, who are relevant for our cause, right? After doing all that, we went to Canvas, uh, and I think we only got started with the first 2 or 3 slides, at which point the timer ended. But yeah, I mean, that's all. I think we got the gist of what we are supposed to do, and that was our experience.
This is excellent, project. I believe you guys made a very good progress. Like in our group, we couldn't come to the preparing pitch deck. Like we were still working on the content. We had some back and forth with ChatGPT, but it was really nice to see your journey. This is really great. And maybe someone who was a part of Biruk's session, like, can you please share with us, like, what kind of journey was that? Was this helpful? Like, did you use ChatGPT that way before? Can you tell us more about how did it go? Yes, Alpha. Or Biruk, maybe you can introduce us some of your teammates.
Yes. So with me, I think we were four. It was Lionel, Gerald, and Yusuf. So let's go with two. Yeah, okay. So maybe Lionel, you can walk us through the experience. You can unmute yourself. Yes, Leonid, go ahead. So Emery was asking how the experience was in terms of
Oh,
the, yeah, in terms
okay,
of the
okay.
idea generation with ChatGPT, and if you ever have used ChatGPT to do that before.
Yes. Thank you. That was a good experience with my collaborator. Firstly, we find the problem. Some problems is very relevant in the field of young girls and employmentship and scholarship. We remark that there is no bridge. There is no really bridge, specifically in Africa and West Africa. So we know with GPT we have to discuss to know more to understand more deeply what problem we have and he helped me to get a real path, real roadmap to build our solution. I think that there can be many future in that. Thank you.
Yes, guys, so I think with the boom of generative AI, we don't use it enough. It's not like the old days. You don't have to do market research by your own. Normally, this will take days, if not weeks, to complete one pitch deck, and it will take a team of people to do it. But with ChatGPT, you have a vast amount of knowledge at the tips of your fingers. So make sure to utilize it if you're not already doing so. But yeah, that was our experience with me and my team.
Thank you very much, Biruk. And who is the next team who want to share their experience with us? Maybe we can have one or two more teams. All right, Nati. maybe let's continue with you, and after that we can conclude with Radiate.
All right. So thank you. So me and my team, we were discussing about uh, building, like solving the problem of education in Africa. And actually, it was education, but not really related to the students, because we thought of the problem that the universities are facing. So universities have a problem setting up servers and launching their portals and maintaining it as well. So we came up with this idea of let me share my ChatGPT screen. We came up with this idea where we have a centralized platform for the setup of their portals, and universities would have like just 5 6 clicks, and then their portal is up and running, and they could invite their students, and they could manage how they share their resources. And first off, we were like trying to brainstorm some names, and we came up the ChatGPT generated some names with for us, but one of my teammates, Future, has actually came up with a really good name. It was a uni gateway because it's for universities and it's a gateway, it's a portal, and we used that. And for the problem statement, we stated that the inefficient resource management for universities, because most of the time their portals are not traffic, and they're just sitting there. The servers are not handling too many requests. And at some times, when there are seasons where the students get their results, it's very crowded, and the servers actually uh, have difficulty coping up with the demands. And we stated that as our problem statement, and we went over to the solution, and we had an idea of like our solution would be quickly setting up the servers, and like it enhances the experience of the universities. And we also had a really good insight on how we could make this idea a business idea, and we thought of charging the universities. We would have a marketing team going around universities in Africa and like talking to the leaders, and having a business out of it. Yeah, and we had a really good session.
Very nice. Thank you very much, Nati. And do you have any teammates who want to share their experience with us?
Yeah, we have Future. Future was one of my teammates.
Future, how did the session go for you? Anything you want to share with us?
He was actually having mic issues there during the session.
Got you. All right. Are there any other teammates that you want to invite to the stage? Or shall we proceed to read it?
Yeah, let's proceed. I think he wrote his experience, Future. The experience was great. I learned a lot.
Beautiful. Thank you very much. And next up, Radiant.
Okay, thank you, everyone. Yeah, so for me and my teammates, we started the session with brainstorming some ideas that we could apply for our pitch deck. So, okay. For our pitch deck. So for the ideas, two of my teammates, they came up with two kinds of ideas. So the first one was the crop detection using AI algorithms, so that farmers could easily detect diseases on their plants and mitigate them. And the second one was some kind of greenhouse, but for the greenhouse part, the part that we would do is automation on the climate control, because when people like grow plants outside of that greenhouse, there is a lot of unfavorable climatic conditions such as heavy rainfall, but in that greenhouse we can easily automate the climate. So there were these two ideas generated by our two teammates, but we merged these two ideas. So in the greenhouse, what we do is in the greenhouse, what we do is we use the crop detection system as well as the climate automation system, that climate control automation system. So can you see my screen? So yeah, for ChatGPT, we just explained our idea that we're thinking of a crop disease detection system, and also inside that greenhouse, we are also planning to automate our climate control mechanism. So the ChatGPT gave us AgriGuard, which is smart solutions for crop health and climate control. This was the title it gave us, and it gave us a tagline. So we started with this. We just talked how to use ChatGPT to generate content based on what we give him or give it. So we demonstrated this, and then we give it. Before that, we divided certain parts of the content and tried to use ChatGPT to generate content. Most of my teammates, they generated parts of the content, but I also generated the whole content here as well. Maybe my teammates can also share their experience here if any of them are here. So yeah, I see Kotsu. Kotsu is from Lesotho too. So Kotsu, can you share your experience in the session?
Yes, I can. Okay. In the presentation. Okay, I'm sorry. Let me just do this. Okay. In the preparation of the pitch deck, my main task was to deal with the business model part of it. So in dealing with the business model part of it, what I have looked in is how can I be able to reach the farmers who will be using this system. So I found that maybe we can provide or reach the farmers by either three ways. The first one being selling the products where the farmers can buy the whole system, or the other one will be renting the system to our farmers where they can rent a particular system for maybe a certain period of maybe let's say 6 months. And then another way will be sharing, like if the farmers has produced this much yield, we will be able to share the yield, that say 30% and 70%, so that each and every farmer can be able to use this system very easy, can access this system and use it very easily. So that's how one of the things that I was looking into, such that the system can be able to sustain itself. Thank you.
Thank you, Kotso. So I think that concludes experience from my teams.
Thank you very much, Rediyet. So before we finally see like another tool and close, any questions, any other points, team, you want to raise, any other experience sharing you want to make? Okay, if there are no other points, then let me also share my screen. Because in the meantime, what I have done, I have actually brought our deck content into presentations.ai. So basically what I have done, so we actually used AfroChat. This is one of A2SV projects, which provides access to different GPT models, like from different companies, like for people who were in different breakout rooms. Like you can see that you can choose which model you want to interact with. So after our session finished, I basically gave it one more prompt to bring us the call to action as well as the full presentation content at once. And then I gave it to presentation AI. And this is what has come out. I didn't take a look. All I did is just bringing the content and giving it to presentations.ai. So now let's take a look what it came up with. Again, I haven't seen it before, team. We will all see the magic of AI together. Bridging healthcare disparities in Africa. Like we didn't choose a title for our presentation. And this is what it come up with. other teams had that discussion. I really appreciate. We forgot. So, what are the problems that we have seen? Lack of access to quality healthcare services in Africa, limited resources and infrastructure, and healthcare disparities, especially in the these are resulting poor outcomes. And our member who has suggested this idea was from Benin. Therefore, our focus was more on Benin. And the current situation in some areas, limited healthcare facilities, high infant mortality rate, and prevalence of preventable diseases. There are some preventable diseases, but lack of healthcare services are making trouble. And this is actually was not part. The last two were not part of our discussion. But when we asked to prepare concise content, they came out. And for the solution implementation, what we are going to do is establishing partnerships with healthcare facilities so that we can develop models with doctors and utilizing the data that is available in those hospitals. And developing a mobile app because we want to bring ease of access to healthcare services. And we are going to train community health workers that are going to work in the public access points and implement telemedicine services so that when people reach to these points, they can actually get help from medical professionals. So when we look at the market opportunity, around 60% of the people in the continent access, have lack of access for basic healthcare services. This is huge. And it is expected for the healthcare market to grow into $100 billion by 2030. And our targets is actually underserved areas because there is a higher demand for essential healthcare services in those areas. So in the revenue model, we had our discussion on this. I would say this is very strong. Like we should all know that GPT is not the cure for everything. And by working on it together, we can improve the content. Like we were spending more time focusing on problem and solution. So for the last parts, we didn't actually have, let's say, the iteration that we need to have to make it more robust. But in my personal opinion, like revenue sharing and partnerships with insurance companies, they seem more realistic than a freemium model or subscription-based model for people who are living in, especially rural area where they don't have internet access. So, like in this slide, we can see what kind of impact it's going to make to people. Again, I'm not going to take much time for the sake of using time efficiently. So when we take a look at the next steps, there is going to be a pilot in a selected region. And keep our call to action content. As I said, I didn't have a chance to check. But team, like as we can see in minutes, this can actually give us a very good point to play with and make it even more robust. Like in the past, putting together such kind of a presentation probably was taking a lot more time, like at least hours. But now, with the help of AI, creating the content and creating, I would say, visually appealing presentations definitely are easier. And again, let's not forget our lesson today. Good can always be better. Like we didn't have enough time in this workshop to make these presentations very robust. But you're not supposed to finish your pitch deck in 30 minutes. Obviously, you can take more time. So the idea was to show you what is possible, what kind of tools are available out there. And with the help of those, we can actually prepare high quality that are going to help us to proceed in this journey of taking ideas from the ground and making them real world solutions. Team, I hope you enjoyed and you learned because at A2SV we try to make both of them together. Thanks for your time. Thanks for your attention. And I want to particularly thank to our organizers, Beymnet Bekele, who is running the whole hackathon show, as well as Zelala and other mentors who made themselves available to help other fellow African technologists. This was really nice. Thank you very much. And always remember, good can always be better. Don't be satisfied with the output. Make iterations, make it better and better. Thank you, team. See you. Oh, before we close, are there any questions? I see Terian, your hand is raised. Okay, any other questions or points, team? All right. If not, please take care and see you in the other workshops. Bye.